New Mexico Cancer Center and Health Specialists of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
So palliative care is a specialty in medicine where the focus is on symptoms management. What does that mean? Being the fact that I work in a cancer center, I have patients that are referred to me to help with the symptoms that are either related to the cancer itself or the side effects of treatment. The goal would be trying to have them be at their best, every day to improve their quality of life while they're going through treatment. So actually it's not at all giving up. It's just to improve, the quality of their days and trying to make them feel as best as possible while they're going through their journey of their cancer treatment. Palliative care and hospice care have the same focus, which is symptoms management. You don't focus on the root cause of your symptoms. You're just trying to make the patient feel better, improve the quality of their days. Now, you can have palliative care while you're doing treatment, while you're having active treatment for your cancer. You cannot have active treatment when you're on hospice. In other words, when you're on hospice, you choose to only focus on symptoms management, trying to make you feel as comfortable as you would like to be. I think because the visits with palliative care are a little bit different. In other words, we try to focus on the whole patients, taking care of both their physical symptoms as well as their emotional and spiritual symptoms. Take a look at all their medication to see what their interactions are. And also, and I think that is very important, focus on what is their understanding of the process of the disease so that they can have informed decisions as they go along. When you have a better understanding of what's going on, what is going to be expected, in terms of symptoms, possible side effects, and you have a better understanding also what the outcomes, what the choices are, you're able to, make better decisions throughout the way, and you feel more in control. Because that's one of the things that often cancer patients feel like they don't have control on what's happened, what has happened to them. In this way, I think they feel more in charge. How do you determine which patients are good for palliative care and not in my practice? So I do have a list, a set of criteria that all my colleagues in the clinic, are aware of. And those are usually all stage 4 cancer patients, which means all the patients that have, a significant kind of cancer where they're already spread, or maybe stage 3, where there is a lot of symptoms that are impacting their, the quality of their days. And then if any of my colleagues has any questions, about a specific patient, I'm always happy to help.